Welcome to episode 17 of the Lymphatic Massage Therapist Book Club. We're looking at chapter 17 of the High Definition Body Sculpting book, and this is liposuction of the female arm. I really like this chapter. I'm seeing a lot of 360 lipo, including the arms. I'd like to show you this picture, so this kind of stuff makes sense when you read the book. So this is why I really like showing you stuff in this book and us going through this book together in the book club. So this is called the youth angle, and it says on page 188, as in a male patient, the inferior border of the female arm with the arm in 90 degrees abduction forms, quote, the youth angle. The more acute the angle is, the more pronounced the tricep muscle mass and the younger the arm looks. So this is maybe the reason why there's a little more like induration hardened tissue in the area afterwards, especially in that upper area. So the next time I'll feel that, I can tell the client why it's there. It is because it's going to make her arm look better after the surgery. And then we'll also look at page 191, the postoperative care. After the procedure is completed, the authors say the axillary fold incisions are closed with subdermal sutures. The elbow incision is left open for drainage and covered with sterile gauze pad. Lymphatic drainage massage is indicated to reduce the swelling and the bruising. External ultrasound should be applied to prevent the formation of excessive fibrosis, since this is an area prone to do so. Also, stretching exercises are recommended to prevent retractions. So I have seen both of these things. I had my first case of retraction. I'm trying to help her now. I will do the lymphatic drainage massage on the arms at the same time. They're having the torso with the lymphatic drainage. I use the same type of strokes and the same type of massage directions and everything that I would do for a client that has lymphedema, the same as we were taught in the manual lymphatic drainage course, so there's nothing different there. But what I do see is a lot of fibrosis, and it's usually over where I would see the tricep muscle. So I have had to, in later weeks, as soon as I feel like it starts going there, I'll begin with lymphatic drainage. I'll use some hot stones and oil to warm up the area, to soften the area. Then I'll use cupping. Sometimes I'll use the flexion and extension of the arm with the cup. And then I'll use IASTM, and again, either stationary or flexion and extension of the arm. And that usually really helps for me, for my clients with their fibrosis in the arm. I'll also say, are you using arm compression? So that's really, it's sometimes difficult to get clients into arm compression because the garment that will fit them, like the garment that they like, will either have no sleeves, it'll be sleeveless and just have straps, or if they have something with arm sleeves, often they'll tell that the arm is too tight. And again, if there's any pins and needles, numbness in the hand, swelling in the hand, the arm garment is too tight and they can't wear it. Another option that I had a client do, I'll talk about, there's an official, something that I would do with a lymphedema client, and then I'll say what I saw one of my clients do that was actually clever. So the official advice that I would give is there's a type of like open weave called edema wear, and that will use the lymphatic alternating pressure profiles. So you can get that in varying sizes. It's also for the legs, so we can just so you should be able to find the correct size in the arms because they make them as large for the legs. So it's just a tube of this fabric that you can buy or the client can buy, and then they can wear it on their arms. It tends to roll a little at the ends, but it's not that bad if you're having it go, all the way up to the arm. And that will just, so there'll be a pattern on the skin, and that pattern is really good because the pattern is going to help to reduce the fibrosis and the swelling through that lymphatic alternating pressure profiles theory. So that's the official thing that I would do. But what I have seen a client do that definitely worked for her, what she did is they gave her an actual decent pair of compression stockings so everyone during surgery gets the TED hose, which we call bed hose because you should be, you have to be like supine or prone. As soon as you're ambulatory, the TED hose are not going to help you. So if you see online all the time, there's these pictures of girls at the recovery houses and they're wearing those TED hose and they're dirty and they're stained, but importantly, they're walking around in them. And once you walk around in them, like, of course you're still going to get swelling because that's not enough compression. Those TED hoses are only for when you're flat out on your back and you need a little bit of compression to get the blood back from the feet to the body. So this lady had some good luck. So she got into an actual pair of light pressure compression stockings. So they were probably 15 to 20 socks. So she wore the socks until she didn't need to wear the socks anymore because her feet weren't swelling. And then she cut the foot off of them and it just wore the tube of the sock on the arm. So when she took it off, I could tell she was wearing one and not the other. On the other arm, she was wearing it on the arm that was a little bit worse for her. And you could see that there was the lines up there. So at least she was getting alternating pressure. At least they made a little bit of an indent, so they weren't that loose. But it was great because she had bought 2 compression garments. One was just like a bolero garment, and she really couldn't get her arms into them because she didn't have an aggressive case of liposuction, and her arms were a little bit on the larger side. And so the other thing is this, what did they call it? Retraction. So if it's what I'm thinking about, I have a client right now that if you pulled the arm, if I put a cup on the arm and pulled it up, I would see there's a difference, there's a tightness underneath. So as her arm's at rest, you can't really see it, but once you pull it, you can see that there's some scar tissue there. It might not be an accurate, authentic retraction because I keep on asking her every time, like, do you have proper range of motion? And she does have proper range of motion, so it's probably not a proper retraction, but it was really interesting that that's happening to her. But just with massage, IASTM, the cupping and the motion, the flexion and extension, I'm trying to reduce that for this client, and then having her continue to wear the compression. And then we'll have to see, I might have to make her a little, a piece of a Medi lymph pad to wear there to see if we can soften that kind of stuff up. And then as soon as she can start doing exercises with her plastic surgeon's permission, just to get her into some of the arm exercises, and either with the cup or without, to see how we can handle that. So anyways, that's a lot about me and not as much about the chapter, but those were the highlights of the chapter, and I look forward to hearing from you and having you watch future episodes. Thank you.